the incredible benefits of breastfeeding from a holistic lens. Welcome to my YouTube channel. I'm Dr. Jinmee Graham, and I'm a naturopathic doctor dedicated to supporting the holistic health of children and families. Today, we're going to talk about the incredible benefits of breastfeeding from a holistic lens. In this video, we'll cover the physical, mental, and emotional health benefits of breastfeeding, not only for the child, but the mother as well. We'll also cover the recommended duration of breastfeeding towards the end of the video. Now, before we begin, I want to acknowledge that discussions about breastfeeding can be deeply personal and bring up difficult feelings, especially for those who've had challenging experiences with breastfeeding in the past or who've chosen different feeding methods. Now, the purpose of this video is to provide information on the benefits of breastfeeding for optimal child health and to support mothers in making their own informed decisions, not to judge or shame anyone. Parents are all truly doing the best with the knowledge and resources they have in their unique circumstances, and this is something I deeply respect. So let's start with the physical health benefits of breastfeeding. You may have heard breast milk being likened to liquid gold, and this is a very appropriate description as the nutritional components of breast milk are quite remarkable. So breast milk contains the perfect balance of nutrients such as proteins, fats, and carbohydrates. And the components of breast milk also evolve to meet the needs of the developing child. So one of the components found in breast milk is something called human milk oligosaccharides, HMOs. And these HMOs serve an essential function of promoting the growth of the beneficial bacteria in a baby's gut. And this supports their digestion and also their immune system, as most of the immune system is found in our guts. Breast milk also contains DHA, which is a fatty acid that is crucial for optimal brain development. So a little caveat here is that yes, while formula manufacturers do try to include some of these components in their formulas and try to mimic the nutritional components of breast milk as best as they can, there are some differences noted. For example, with DHA, the DHA found in breast milk is way more bioavailable and easily absorbed and usable by the body than the DHA found in formula. Similarly, some formula manufacturers do try to include certain types of HMOs in their formulations, but unfortunately, they just can't replicate fully the diversity and complexity of the naturally occurring HMOs found uniquely in breast milk. So there is a little bit of a difference there. Breast milk also contains immune components such as antibodies. The primary antibody found in breast milk is immunoglobulin A, IgA. And what IgA does is that it coats the mucosal membranes of the body, the baby's body, such as the respiratory tract and the baby's gut. And what this does is it provides a protective barrier preventing access of pathogens to affect and impact the baby negatively. So IgA is specifically great at neutralizing viruses and bacteria and is that really key early support for the baby and their developing immune system. Young children, right, new babies don't have a fully mature immune system like adults do, so they really rely on things like these immune components found naturally in breast milk. So that design was really wisely intended for the benefit of the child. Now, laboratory studies, pretty interesting, have been done using petri dishes and different strains of bacteria, such as E. coli or different strains of Streptococcus or Staphylococcus bacteria. And what they did to the bacteria is they added drops of breast milk onto these petri dishes with bacteria. And what they observed was that around the drop of breast milk, you see almost this protective ring around the breast milk, showcasing the antimicrobial properties of the breast milk to neutralize the surrounding bacteria. When they've done similar studies or experiments with formula or even cow's milk, they didn't see those same types of protective effects. So this is a very unique and incredible immunological benefit to human breast milk when it comes to supporting your child immunologically. Now, breast milk is a living, dynamic food that provides real-time immune adaptation for the child. This is due to something called retrograde flow, which is a fancy way of saying baby backwash. So how does this happen? Every time a baby latches onto the mother's breast, the mother's body is surveying the environment of the baby's mouth and saliva and searching for any pathogens that may be present at the time. If it detects any pathogenic presence or need of that baby for support, this sends a signal to the mother's body, and then in real time, the mom's immune system changes the composition of her breast milk to support the baby's specific needs during that time. So these components then enter her milk and then enter the baby, the nursing baby, as it nurses. And now the baby is getting that extra protection through the interaction with the mother and her breast milk directly, which is quite remarkable. I remember hearing this and learning this for the first time and just thinking that was one of the most amazing things I have ever heard, and just showcases the incredible wisdom of our bodies and of our natural design. So in women who've pumped during acute illness of their child, they've also noticed differences visually in the composition of breast milk. So while the breast milk usually looks like a white consistency, when the baby is ill or struggling with something and they've pumped that milk during that time, they've noticed a more orangey yellow consistency, showcasing more of the immune components present in the breast milk at that time. We've talked a lot about many of the physical health benefits of breastfeeding for the child, but let's cover some of the physical benefits to the breastfeeding mother, because there are some remarkable ones. So one of these include a reduced risk of developing certain types of cancers in breastfeeding women, such as reduced risk of breast and ovarian cancer. So why is this the case? Well, the hormonal changes that occur during breastfeeding, such as the reduction in estrogen, provide this type of protection, right? These types of cancers, breast and ovarian, tend to be sensitive to the hormone estrogen. So throughout a woman's lifetime, when she has periods of time when the levels of circulating estrogen in the body are decreased, it also decreases the likelihood of those types of cancers developing. So there is a protective effect. Other health benefits to breastfeeding include a reduced risk of developing type 2 diabetes and cardiovascular disease. And the greater protective effects are seen the longer a woman breastfeeds. So the longer she breastfeeds throughout her lifetime, the greater the benefits she experiences with her own health. Now, looking at some of the mental and emotional health benefits of breastfeeding, in long-term studies looking at the effects of breastfeeding on children, they've seen that children who've been breastfed tend to score higher on cognitive tests and perform higher and better academically compared to their non-breastfed peers. Now, one reason contributing to this is due to the DHA that we talked about earlier, present in breast milk and more bioavailable in breast milk than it is in formula. So this DHA really contributes to, again, the optimal brain development and cognition that is supporting the baby's brain and cognitive health even later in life. Emotionally, during breastfeeding, the hormone oxytocin is released in both the child and the mother. Now, this is called the bonding hormone or the love hormone, and it really does create a deeper connection and bond between the mother and nursing child. This also supports healthy and secure attachment, which is very crucial in those early years for a growing child. Oxytocin also reduces stress in both mom and baby and promotes emotional regulation and resilience. And they've seen that in infants who were breastfed, there is a reduction in the risk of those children developing anxiety and depression later on in life. A common question that gets asked, of course, is how long should I breastfeed my baby? What is the recommendation and the best practice here? The World Health Organization recommends breastfeeding your child up until 2 years of age or longer, so long as it's mutually desired by both mother and child. This, of course, is a very personal decision, but extended breastfeeding does provide benefit well into the toddler years with no detriment found physically, mentally, or emotionally to either the child or the mother with extended breastfeeding. That sometimes tends to be a concern by family members or maybe other members of society who are not used to seeing a bigger child, an older child, still nursing a little bit. Without any outside interferences, children usually tend to wean themselves naturally from breastfeeding between the ages of 2 and 7 years of age. Let's support more of the mothers in our community who are choosing to breastfeed and who have kids who want to breastfeed a little bit longer than those early toddler ages. It is a beautiful support. It is very natural, and it still is supportive and, again, not harmful at all. Breastfeeding is a journey that not only provides physical benefits, but also mental and emotional health benefits to both child and mother. There's a beautiful quote that says, breastfeeding is an act of love, a gift that lasts a lifetime, and a foundation for a healthier future. If you like this video, stay tuned for more content about supporting the holistic health of children and families.